Hello again, this is Dr. Sharawi, and today I'll be talking about the kidneys or nephrology. Basically, nephrology is the study of kidneys or renals, and we have basically two different kidneys, and both of them are located into the retroperitoneal organ. What does that mean? Retro means behind, peritoneum or the peritoneum, which is the fat kind of surrounding or behind the stomach itself. So let's go ahead and dissect and look into the kidneys and search through them. So this is not a kidney, this is just a stomach. Passing through our liver. Nope, not yet. The colon, removing the colon. Nope. And I think we didn't find it yet because this is the pancreas. Is that the kidney? No, that's actually spleen right there. And those are the two hiding organs we're looking for. So those are the two kidneys, and we see that they are all the way in the back, retroperitoneal organs. Not only that, it's pretty interesting that if you look into the right and the left kidneys, so this is the right and the left kidneys, we have kind of a sorted elevated portion. So the left kidney is a little bit higher than the right kidney. Not only that, it's kind of funny that we have two cone heads or cone-shaped organs, and those are called the adrenal glands or the suprarenal glands. All right, so let's look at the drainage through the kidneys. So we see over here that we have two different veins coming off from the right and the left kidneys, called the right renal vein and the left renal vein, and those are blue because there are deoxygenated blood, and they're going into or draining into the inferior vena cava. Not only that, now we have an abdominal aorta, or the descending abdominal aorta, would give two different branches, which will be the left renal artery and the left adrenal artery. And again, we would have the right renal artery right there as well. Okay, so this is the right renal artery, and eventually it will give us or branch off into the segmental artery as well. Okay, now we spoke about the hilum or the renal hilum. Now the renal hilum is a region, it's not a particular point. Now the word hilum, if we look into the other module here, okay, if we look into the other module here, let's grab this one over here. Oops. So let's grab this module, and actually what I did is that I brought a skeletal system as well, and that's where they are located. Okay, so let's kind of do the switch around here and show you something before we proceed. Now the kidneys are being protected by the last two ribs, and those are called the floating ribs. And basically what's happening is that they are located right there on the spot. That's why on a street fight or actually boxing federation, once we have fracture of the last two pairs or any of the sides, pair of ribs, which are the false ribs, you're traumatic or traumatizing the kidneys, and eventually this could serve as a very serious and critical case if we have ruptured or injury or damage towards the right and left renal arteries. Okay, so there we go. Definitely that individual will be more prone, if it's excessive bleeding we can't control, then he might lose one of his kidneys. Now an individual could live with a 25% of a single kidney only. So imagine we have about maybe 8 times than what we actually need. Okay, so let's go ahead and look at the renal hilum again, back to our topic. So we have the right renal artery, right renal vein, then we have the renal pelvis, and eventually we would have the ureters opening up, and definitely whenever we have vessels we would have the lymphatic drainage. It's not present right here, but basically it's just draining the excess fluid from the kidneys as well. And we would have different nerves and neurons that will be supplying the kidneys and the supraadrenal gland as well. I'll speak about the different nerves as well in brief, or actually their function onto the adrenal glands. Okay, so again, this is the draining renal veins into the inferior vena cava, and this is the abdominal aorta, giving our branches towards the right renal artery, towards the right kidney, left renal artery towards the left renal kidneys actually, and eventually we would have the adrenal arteries as well, supplying the adrenal glands. Okay, so let me go ahead and pick the left kidney and kind of cut through longitudinal over here. So eventually we would have this view. Okay. Now just to kind of as a continuation, this is the common iliac arteries, right and left, and the ureters are descending anterior to those vessels, and eventually they would open up into the urinary bladder. And this is the urinary bladder. If we do a dissection and kind of open up through here, we find that the detrusor muscle, which is the thickness of the urinary bladder, this is called the detrusor muscle. This is a rugae, which is the elevation depression within the urinary bladder, and we have a prostatic gland right there, so we know for sure it's a male. Then we have the urethra passing through. It's called the prostatic urethra, and eventually it would open up into the penile urethra. Now let's go ahead and speak back within the scope of the kidneys. Alright, so let me go ahead and speak about the renal. So this is the left renal artery that would separate into segmental artery, and it would subdivide further into different branches. Now this looks like a pyramid, so we call it the pyramidal tract. Okay, those are different tracts. And within the pyramids, if you look over here, this is a magnified view. This is the papilla itself, and it will open up into the minor calyces, and that's where the filtration process takes place, briefly. Okay, so let's go ahead and do a continuation of the arteries as we were speaking. So between the lobes, we have different lobes. So this is an inverted pyramid. So this is the apex, and this is the base of the papilla itself. So again, this is the apex, this is the base of the pyramid itself. See over here, those are the base, and this is the apex, 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 apex. Okay, now in order to have the filtration process, we have the segmental artery that will form into different branches. Okay, so if it's between the lobes or the pyramidal tracts, okay, between the lobes, we called it the interlobar artery. And definitely if there is an artery, there will be a vein. And again, this is called the interlobar vein as well. So once the interlobar artery will further branch into the base of the pyramid, it's called the arcuate artery. And again, we have the arcuate vein, which is blue. Not only that, it will subdivide further into more and more branches, reaching the cortex, which is the outer portion. Keep in mind that this is the cortex, represent about 20%, then the renal pyramid, it's about 80%. Now for the cortex, then is being covered by the capsule as well, or the renal capsule superior, which is kind of a glistening adherent capsule similar to the liver itself. Okay, so if you focus over here, those branches called the interlobular or the cortical radiation arteries. Not only that, the arteries will coalesce along within the capillaries, and eventually they would have the veins. So this is called the interlobular vein, and again it will drain into the arcuate vein and further down into the interlobular interlobar vein, and eventually goes into the segmental vein, into the renal vein, and eventually this will go into the inferior vena cava, or drain into the inferior vena cava. And keep in mind that we have an artery and vein supplying over here, but it's not shown. And again, it's a branch of the renal artery if it's right or left. And again, the venous drainage will take along the same pathway as well. Alright, so let's go ahead and look at the yellow circles we have over here. So basically, this is the functional unit. It's the beginning of the filtration process. Okay, so this is a capsule-like, and it's called the glomerulus. So it's being fed by an inflow of artery, which is oxygenated blood. Now, this is a magnification of this yellow capsules right there. This is just a cut section. We get kind of removed the Bowman's capsule itself, and that's what's lying underneath right there. Okay, so if you look over here, so this is a high rich blood flow. It's inflowing into the Bowman's capsule, okay, and it's called the afferent. A starts with an afferent. So anything that's going in, it's subdividing into the different tuft of capillaries, which is a collection from 5 to 6 different capillaries. And it's kind of funny that it kind of filters out the blood to pass into the proximal convoluted tubule, which is the beginning of the filtration process right there. So we always track down the glomerulus, then we would know the different names for the tubule. So again, the afferent is the inflow of blood reaching into the different capillaries, which is a tuft of capillaries, and this whole thing is called the glomerulus. This is just the filtration pores itself is called the podocytes, which is the cells where the filtration will take place. So basically you would have the same osmolality, about 300 milliosmolars, roughly similar to the blood, but with the exception of having the RBCs or the white blood cells as well. So it would be the same plasma level, kind of. Alright, so basically you would have different fluid passing into the proximal convoluted tubule. So once we have the filtration process takes place, it looks like a capillary, then we would have the efferent moving out. So the efferent, it is an artery, okay, and it's moving out. So it's the blood that's flowing outside the renal corpuscle or the Bowman's capsule. So the inflow is the afferent glomerulus, then it passes out through the efferent tubule. Okay, now what is this? This is basically the distal convoluted tubule itself, and that's the macula densa. The macula densa, along with different cells, it would form the macula complex. Okay, so basically that's present between